Chapter 10: Children with Communication Disorders. Children with communication disorders may have subtle difficulties or obvious problems in speaking. They may also have subtle difficulties or obvious problems in understanding or hearing. Because communication is central to the educational experience, teachers do play a key role in recognizing students who are experiencing significant problems. And they play a key role in helping these students communicate effectively in the classroom. Some key terms and definitions for this chapter include communication, language, and speech. Let's look at communication first. Communication is defined as the exchange of ideas, of information, of thoughts and feelings, and it involves two or more people. Activity or inactivity, words or silence, they all have message value. The next key term is language. And language is the verbal means by which human beings communicate. Now, language is governed by rules, and rules are different in each language. The rules of language that govern its form or structure are called grammar. Now, linguists describe 5 interrelated components of language, and each have a rule system. So as you can see in the chart, phonology describes its rules on how we combine phonemes or sounds to form words. Morphology has morphological rules that tell us how word meaning may be changed by adding morphemes. Syntax has syntactic rules that govern how words may be combined to form sentences. Semantics have semantic rules that tell us how language users create and understand word meaning. And pragmatics is the language component that involves knowing how to use language appropriately in a social context. The third key term for this chapter is speech. And speech is the physical action of orally producing words. Speech is also the product of complex, well-coordinated muscular activity, from respiration to articulation. And we know there are approximately 40 to 45 phonemes, or what we call speech sounds, in spoken English. When we look at language development, we know that most children develop initial competence as oral communicators in their first 3 years of life. So think back to theories of language acquisition. Those attempt to explain how children learn to communicate. Now, the IDEA has their definition of language impairment. And just so you know, the terms language and speech and communication disorders are going to be used synonymously. So for IDEA, language impairment means a disorder that adversely affects a child's educational performance. Now, a language disorder involves a delay in understanding others, in participating in conversations, or even in using language appropriate to the listener or to the situation. A language disorder also involves difficulty using spoken or written language, which is known as expressive communication. And it can involve the understanding of other people's spoken language, which is known as receptive communication. In terms of expressive language, we know children whose primary difficulty is in learning and using language can be sometimes referred to as a specific language impairment. Now, many children with language disorders have significant problems with school achievement. And these language disorders can persist into adulthood. But keep in mind that a person's behavior can serve as a form of communication. And if we, the adults, can determine the communicative intent of a child's misbehavior, then we can work to substitute a more appropriate behavior. Think about chapter 9, where we talked about communication in children with autism. Now that we've looked at expressive communication and receptive communication as the two main types of language disorders, let's move on to speech disorders. Under speech disorders, we will look at three of the main ones: articulation, fluency, and voice. Articulation disorders are the most common communication disorders during the elementary school years. Mispronunciations of speech sounds are very developmentally appropriate in young children. They are considered phonological disorders only if they persist far longer than would be expected, and if the speech processes themselves are abnormal. In terms of fluency disorders, we're looking at interruptions in the flow of speaking. The most common fluency disorder is stuttering. And stuttering is basically excessive sound of syllables, word repetitions, and sometimes sound prolongations, sometimes pauses. Now, the evidence supports that stuttering is genetically transmitted. And the onset of stuttering is typically in the preschool or primary years. The best thing to do is to refer the child to a speech-language pathologist for an evaluation and possible treatment. And the last one is voice disorders. And these disorders can affect the pitch, the loudness, or the quality of the voice. And the first rule, or the first step, is to rule out medical causes of the problem. Now, there are dialects and language differences, and a dialect is not a communication disorder. A dialect is a set of speech characteristics that are shared by a regional or social or cultural group. But teachers need to be aware of how dialects are used in their students' communities to prevent misidentifying a language difference as a disorder. As teachers, it is important to be able to recognize children with language impairment in our classrooms. So some things to look for include the following. 1, if a child fails to understand and follow directions, that might be a red flag. The child is unable to use language to meet their daily living needs. That is another red flag. If the child violates the rules of social interaction, including politeness, if the child lacks ability to read some signs or other symbols, or even to perform written tasks, that's a sign. If the child has problems using speech to communicate effectively, that's a sign. Others include the child's demonstration of a lack of appropriate organization when they're speaking and when they're writing. They do not remember significant information that's presented orally or in written form. If they do not recognize humor or indirect comments. If they seem unable to interpret the emotions or predict the intentions of others. And if they do not respond appropriately for the situation. Keep in mind that these can be language disorders, not necessarily speech disorders. So then what kind of help and support might the classroom teacher want? Teachers might consider using the 3 levels of language intervention strategies, where intervention becomes more focused and more intense at each level. So level 1 is basically best practices for typical language learners and enrichment for students who are learning language successfully. Level 2 requires procedures to be used with children who are not acquiring language at the same rate as their peers, or for those who are learning English as their second language. And level 3 is more about interventions that are disability specific. And some examples of that would be like sign language, the finger spelling technique, concept development, or any augmentative communication technology. The relationship between speaking, reading, writing, and listening is complex. Most of us have strengths in one or another of those areas. Think about how life would be if one of those strengths was taken from you. Think about what kind of accommodations you would need if you were not able to speak or communicate clearly. Now let's look at teaching strategies and accommodations. We will start with assessment for identification of communication disorders. The research shows that in best practices, teachers and speech language pathologists, they work collaboratively to identify students with communications disorders. And we must understand that great care must be taken with children from non-English speaking backgrounds. Only those with problems in both the first and second language can be considered to have a disorder. And a fair assessment must take both the native language and the language of the school into account. Next, teachers should look for communicative competence in their English language learning students. In other words, these are children where English is not their home language. Communicative competence includes the ability to comprehend language as well as the ability to use it in a variety of contexts. And we're including conversation with different speakers. We're talking about formal and informal speaking and understanding the speech of others. Now, the speech language pathologist has an approach to assessment. We will look at that next. Now, the SLP, or speech language pathologist, is a professional who often provides the services for a child with an IEP who has communication goals stated on their IEP. This specialist can provide services inside or outside of the classroom, and they tend to collaborate a great deal with the teacher to meet those goals for the child. A lot of their work consists of assessments, so they may start off by talking to the student's parents, some of the student's teachers. Then they will note a little bit of the student's history in terms of academic history, maybe some medical history. They may perform some checklists and developmental scales, and use maybe some curriculum-based assessments. They may also do observations and take some anecdotal records. Now, the teachers can use these approaches as well. And another useful assessment for the teacher is a language sample. Language sampling can provide a picture of the student's current level of communication in the classroom. The most important thing to know is that collaboration is very important between the student's teacher and the SLP. Lastly, we will focus on strategies for working with students who have communication learning needs. We know that a classroom focus on English language acquisition really benefits all students. So first, you want to integrate the teaching of both social and academic language into daily routines and curriculum, because this strengthens school learning for every child. The way this is done is through listening, speaking, writing, and reading. You also want to integrate language and literacy learning. Now, since reading, writing, listening, speaking, and spelling all share communication as their purpose, communication instruction should be integrated into classroom learning. For students with communication disorders, the goal for instruction is always enabling communication competence. Supportive discourse scaffolding. This is an instructional structure that a teacher provides as the child's communication skills emerge. What that means is the teacher slowly begins to decrease assistance in terms of support for the child.